Yeah, it's funny. I sometimes will go to the bedside and I'll get a consult and I'll introduce myself as spiritual care, and sometimes a knee-jerk reaction will be, that's okay, I'm not religious. And then I'll pause and I'll say, oh, I said, that's okay, I'm not either. And then they'll kind of do a bit of a double take.
Welcome to the Specialty Café, the podcast that helps you, medical students, find your perfect specialty. My name is Cameron Wong, and I'm a current fourth-year medical student at Queen's University. I'm very excited to be producing this episode as a part of the special Prep for R1 series, which is a series that hopes to expose medical students and residents to the various different allied healthcare professionals that they'll work with in the hospital, that they'll work with to provide the best patient care possible. And I'm very, very excited to be producing this episode with Suzanne Robertson, a spiritual health practitioner at the Kingston General Hospital. Thanks so much for meeting me, Suzanne, here. I'm super excited to be chatting with you.
Awesome. Thank you for the invite. I was delighted to be asked. I love talking about our profession in any chance I can get.
All right, so before we begin, do you think you'd be able to introduce yourself, Suzanne?
Yes, I'd be happy to. My name is Suzanne Robertson. I work at Kingston Health Sciences Center here at Kingston General Hospital. I'm a spiritual health practitioner in our spiritual health department. I've been in the field for about 10 years, with my training commencing in Toronto at the Center for Addiction and Mental Health. And then I did some training over at the University Health Network. And started off my career within the Med-Surg intensive care unit at Toronto General Hospital. I've done some work on organ transplant, in rehab, and at KGH, I do mostly internal medicine, neurology, and I also work over on the inpatient psychiatry unit. So I have a broad spectrum of experience. And in our field, as a spiritual health practitioner, I've gone through, in terms of my education, I've gotten, usually we have master's degree. I have a master's from Emmanuel College in Toronto in spiritual care and psychotherapy. And I'm accountable to sort of two bodies in my profession. As a spiritual health practitioner, I'm accountable to an organization called the Canadian Association of Spiritual Care. That's our national governing body for spiritual health or spiritual care practitioners across Canada. And many hospitals are also requiring us to have certification as registered psychotherapists. So I'm also really happy to be a part of the College of Registered Psychotherapists in Ontario. So those are the two governing bodies that sort of oversee the work that I do.
Great to know. I think something else I'd like to tack on to your extensive bio of having worked in so many different departments and specialties is that you, at least in my mind, are one of the nicest people at the Kingston General Hospital. And one of the reasons why I really thought first of you to invite you is because back when I was a med student on internal medicine and we had paper charts, I was looking for a patient's chart for so long and I was getting so flustered. And I think you saw me and just dropped everything and helped me look for it. And it was so kind. That really stayed with me. So
I love that. Thank you for
yeah.
saying that.
I want to start off and just have our listeners know, how would you define spiritual health?
Spiritual health is the most holistic modality of patient-centered health, where we encompass a person's spiritual care, their emotional needs, their mental health needs, and their psychosocial needs as they journey through the medical system as a patient. We provide that version of care to both patients and families within acute care settings. And part of our role as well is that we actually also offer a lot of staff support for residents, for physicians, allied health, nursing, around issues around moral distress, burnout. So we kind of wear many different hats within the hospital setting.
I was exposed to the second part of what you just mentioned of the spiritual health role in supporting the people who work in the hospital, because Tim, your coworker at KGH, the Kingston General Hospital, was running the free tea and scones cart around the ICU where
Yeah.
I'm currently on rotation. So
Yes.
yeah, that's how I came to know of him as well.
No, absolutely. It's such a rewarding part of the work that we do. Having the privilege of working alongside all of these other professions throughout the ebbs and flows of the stress and the environments that we work in. We work in these really trauma-laden and at sometimes very stressful environments. And so it's very helpful to have colleagues who have a lived experience and a sense of intimacy in terms of the proximity of some of the issues that you're dealing with. And it allows us to be able to afford time and space to be able to help our staff members in that capacity.
What does your day-to-day life look like as a spiritual health practitioner?
Part of what I love about the profession and this job in particular is that every day is completely different. I'll arrive on the units and check in with staff members. I'll go to rounds and consult with the medical teams and the allied healthcare teams, and I'll get consults we can get consults through physicians, through residents, through nurses, through physiotherapy, and we will get pointed out to often patients who are going through some sort of existential crisis, people that are dealing with really difficult diagnoses. I do have a lot of end-of-life care here. If folks are starting to talk about facing their own mortality given a difficult diagnosis that they're getting, will be consulted to go in and provide support in that capacity. If they see family members really being stressed out around their patients or their loved ones' healthcare situation, will be asked to come in for family support. We do a lot of grief and bereavement in the broadest sense of the term. Sometimes grief and bereavement is being called to the bedside to support family because a patient has died, but sometimes it's for a patient who, like on the neurology unit, I will often be called in for folks who have had strokes or brain tumors, and suddenly they're grieving the loss of a way of life, the loss of an identity, the loss of an ability to care for their family in certain ways. So my day looks incredibly different given what the needs of the patients and families are.
Wow. All of which, like you described, I would describe as being extremely important work. I might even say heavy in terms of the types of situations you're helping patients to navigate. Like you mentioned, your day can consist of like helping a family navigate a very difficult diagnosis, to helping a patient grapple with concepts of their own mortality and beginning the process of dying, essentially. Very varied, but yeah. Does that weigh on you at all?
Yeah, yes, and what provides some sense of equilibrium for me is that it is enormously rewarding work. I get to meet incredible, incredible people all the time, extraordinary people going through these everyday experiences that all of us at some point in our lives are going to be facing. And so it enriches my life enormously. It's a place where I can feel of service, that I'm doing some good work. And it is a way to recognize a person's humanity in sometimes situations where they feel very pathologized or medicalized. And that in itself can be a pretty radical intervention for patients and families.
I can imagine, like, well, especially from the medical side, oftentimes we're very concerned about managing as many of like the issues on the issue list we've created as physicians, trying to make sure we've dotted our I's, crossed our T's in terms of medications and making sure people get their investigations. But oftentimes, like a part we don't focus on as much is the humanity behind experiencing what a patient might be experiencing, of which like you pay such exquisite attention to.
Thank you.
Yeah. Something that I wanted to ask in terms of a bit of a myth busting question
Mm.
is about the scope of spiritual health. Now,
Mhm.
I have to admit, as a med student, I never consulted spiritual health because my assumption was that I could only consult spiritual health if someone was religious and
Mhm.
they were having, I guess, like and they wanted to speak to someone about either like spiritual distress or emotional distress with regards to that. But that doesn't really seem to be true from based on what you said.
Yeah, I appreciate the question, and by all means, our profession was originally known, I think, as religious and spiritual care services, and by all means, our roots have come from religious care entering kind of the term pastoral care entering healthcare institutions. But as our society has changed and our notions of spirituality has changed, our profession has changed as well. And by all means, we, like I said, are within a secular organization. Our definition of spirituality is as broad as our patients and families that we serve. And one aspect of that absolutely is religion. If somebody has a religious belief system, then absolutely it is our role to attend to that, and support them and leverage it if it is a helpful component of their healing journey in a hospital. And so we are also called upon to do prayers, to do rituals to facilitate um, patients with different spiritual leaders. If they don't have that, then we can act as a bridge or a conduit in that way. But again, that's just sort of one component of what it is. We do a very important component, but our profession has been going through a transformation just as society has. If you look back even in the past 10 years on Stats Canada, you'll see in terms of our ethnographic and identity and religious background of our society, it is changing radically. And people who are affiliated with religions has been dropping, and people who are identifying as spiritual but not religious is also increasing. And so we are kind of bridging the gap and needing the very diverse, wide spectrum of needs in that capacity.
That sounds like extremely important. It's like, especially given like what you mentioned in terms of, well, the changing demographics of Canada and like applicably the types of patients that are coming into hospital who, I guess like based on what you mentioned, I would guess to be sometimes spiritual but not religious, and so would absolutely like benefit from like your focus.
Yeah, it's funny. I sometimes will go to the bedside and I'll get a consult and I'll introduce myself as spiritual care, and sometimes a knee-jerk reaction will be, that's okay, I'm not religious. And then I'll pause and I'll say, oh, I said, that's okay, I'm not either. And then they'll kind of do a bit of a double take. And sometimes that creates a little window to be able to have a conversation, to allow a person to kind of step into a period of reflection in terms of just where they're at in terms of their emotional needs.
That is really interesting to hear. That that's like a common experience for you and with patients. I can imagine that like kind of an extension of that is that like the maybe belief that while not everyone might be religious and like bin themselves into a certain religion, oftentimes people do have spiritual beliefs, not all of which like fall under a label, but like when you unpack it like in an in-depth conversation, they really come to the surface and like are intricately tied to what people's like wishes are with their health, their goals, their regrets, all sorts of like different things in their life.
Absolutely, absolutely. Again, exactly what you're saying. A person who is an atheist can have an enormously rich spiritual life that is filled with meaning and purpose. But the language and the nomenclature that they use around that and the beliefs, that's the framework that they're coming from, and we can easily leverage that and work with that as well.
And so in the overall context of like the medical team with all of its like medical staff as well as like other allied healthcare staff, where is your role and like how do you fit into making sure a patient gets the best care possible?
It's a good question. What I love around the places that I've worked is that they are deeply collaborative environments, and for the most part, the teams that I work in recognize that good healthcare involves all aspects of a person's humanity, and so they're going to recognize that spiritual care is a really helpful component around that, especially in terms of the relational aspect, relationship building with families and patients. We can often be really kind of helpful conduits as well in terms of communication, in terms of where patients and families are at, and the medical teams and what the allied health teams are dealing with. So it feels like we're pretty well integrated in terms of the entire healthcare team in that way. We go to rounds. We sit on different committees. We're very visible. We provide psychoeducation. Sometimes we get to be a part of different trainings when different allied health professions are entering the field. So yeah, it feels like we're at least within this healthcare system, we're becoming more and more integrated, which is wonderful.
Right. And in the care of a patient who is like particularly complex and requires the care of like many different people, including you, do you have like a brief example of like patients you've seen in the past few years where like a conversation you've had and like the care you've provided has really made a huge difference in allowing their care to like turn around for the better?
There's a patient, the first patient that I think about was a woman who I was called to the bedside for simply because the medical team was noticing that she was very isolated, did not have a lot of people coming to the bedside. She had a stage 4 diagnosis, a stage 4 cancer diagnosis, seemed to be in distress, but it was also pretty withdrawn. And that, that was all I got. That was sort of what the consult note gave me. And so in going to the bedside, I started to build a rapport, a therapeutic alliance with her. She was very distrustful of just medicine and institutions in general, and it took some time to build some trust with her and build that rapport. And then I start to hear about her life narrative, find out around some of those key aspects of her identity in terms of what she prized most. We found out that she had a couple of sons. We found out that she, at times, had had a history of trauma, very and helpful for the team to be mindful of having a trauma-informed care approach when they're engaging with her. And then over time, she started to articulate that she was starting to think about wanting medical assistance in dying. And it was something that she was considering, and I don't think that she at times was overt in naming that with the medical team, but she became pretty explicit with naming that with me. And so it was very helpful for me to take that back to the team and say, hey, we're starting to have these conversations. Have you guys broached that topic with her? And that enabled the medical team to kind of go in and have a more fulsome discussion around her goals of care, around what she was thinking of and looking at. It enabled us to advocate to try to get an assessment as soon as possible because her cognition was starting to deteriorate. She was in a lot of physical suffering, and yet palliative care was doing their best to manage her symptoms. And she ended up being eligible for medical assistance in dying in the hospital. And through that process, I thought, okay, that's the end of that. That's amazing. She's going to have that. That's wonderful. A date hadn't been set for that. And so I had left her on at the end of 1 week, and I kind of was like, I'll see you later. I didn't get to talk to her for a number of days. And then I was off, and I got a call before I was coming back into the hospital. And it was this palliative care doctor saying, are you in the hospital? This patient is going to receive MAID today, and she wants you to be there when it happens. And I wasn't in the hospital that day, and I was very moved that she wanted me there. She was not, her cognition was sort of fluctuating, and the last time I saw her, she was very sleepy, and so we didn't get to have a fulsome discussion. And I then came in, I talked to them on the phone, and I talked to my colleague, Tim, who was a wonderful conduit to have that communication with the team. And in saying that I would come in the next day, the patient decided that she would like to wait and delay medical assistance in dying until I could come the next day to be with her.
Wow.
And that was a very, very special unexpected experience for me where I have had the privilege of being present with people at the end of life and who are receiving that as a way of dying. But I didn't realize that she wanted me there. I would have been there in a heartbeat if I had known. And the very fact that she waited and asked, and I could be with her at the end of her life and really tailor those last few hours in a way that was a very therapeutic healing environment for her to leave this body, leave this life, was a real privilege and honor, and I think allowed her to die a good death with some dignity.
You speak with such humility about uh, the interventions you were able to like make with this patient and like exploring her background, which had not really previously been explored until you took the time to sit down with her, and I think patiently work with her to discuss what mattered most to her, what her background is, how that like would inform what her goals of care were, which included medical assistance in dying, as you said. And while you were talking and kind of like revealing her change in attitude, it reminded me of, well, like it's going to sound cliche, but like the power of words, and like
Mm,
what I mean with that is a
mm,
lot of people, and including me, entered med school, and when I entered med school, I really want to see a cardiac surgery happen. I want to see the chest open, and I want to see the beating heart and grafting the vessels onto the heart. And sure, I think in concept and in appearance, it is quite impressive, but I think like also extremely like laudable is the ability to use words to understand like what people's like conceptions are of like their current situation, use words to like feel that they can feel trusted, or they can trust other people, that they can feel safe to talk about themselves. That in its own way is its own like impressive cardiac surgery, in that I think
I
um,
love that.
yeah, I think it's just really beautiful to witness. I've been able to witness it a few times, especially on like psychiatry, and even infectious diseases, like specialties where you are treating patients who are very ill, and those conversations around death come up. And so I think it's so important to have people like you who can do those impressive interventions with words and change a patient's life for the better.
Thank you for that. Thank
Yeah.
you. Yeah, really, my my one of my biggest learnings I think in this work is that relationship is everything. Relationship is everything. And whether you're a spiritual health practitioner, whether you're a resident, whether you're a nurse, whether you're a PCA, relationships to our patients and family is everything. Yeah.
Yeah, we in a way are nothing without our patients. It's
Yeah.
very true,
Yeah.
regardless of what role you have in the hospital.
Yeah.
I wanted to change gears a little bit for the last bit of the podcast,
Sure.
and touch upon the overall purpose, which is to gear incoming fresh first year residents, or ones, to hit the ground running when they start residency.
hmm
What in just in terms of like a basic question, when should someone consult you if they're thinking a patient might benefit from your attention?
Great question. I'll give you a couple examples of sort of what it looks like. I got a consult from a resident just the other day because she just had to provide a life-limiting prognosis to a patient that had come in through Emerge, completely thought they were healthy, developed symptoms over the past few weeks, and found out they had full blown all the way through them. Literally just saw the impact of what that was for that news to land on a patient and family. I got the consult the next day, gave them a little bit of a breathing space for that news to sink in, and then I could go up to them the next day and just sort of be like, okay, I heard you got some big news. How are you dealing with that? So life limiting, difficult prognosis, difficult diagnosis, folks that you see that are quite isolated, who have very limited psychosocial supports, who at times probably are struggling with some mental health issues, but are in the hospital for various reasons. We get a lot of consults for folks struggling with anxiety, emotional distress. Affect regulation is a problem. We get consults for grief and bereavement. Often patients are in the family when loved one members die, and so we're coming to the bedside because of not only what they're going through, but because somebody in their family has died.
And what are some tips you'd have for incoming residents to make sure they pay best attention to a patient's possible spiritual health needs?
Great question. I think a part of it is actually being really present with the person and really attentive to how they're doing as are they holding the information that you're giving them? Can they actually retain what it is that they're saying? What's their body language telling you? Are there people around them or not around them? One really easy thing that you can do, especially if somebody is sort of struggling, is you can just simply say, hey, what are the things that you lean on when you're going through adversity, when you're going through hard times? That can be a real doorway to just sort of be like, oh, what is a person's spiritual resources? Are they lacking? Are they full? Is there a role for spiritual care in that? So that can be just a really helpful shortcut. And there also are, if residents are interested, there are a plethora of really quick spiritual screening assessment tools that you can look out there. There's one called Hope, there's one called Fika. Anyways, but they're just really simple. It can be 3 questions at the end of your visit that sort of do a little spiritual screening that kind of give you a sense of whether or not there's some needs there.
Wow. I'm heading into internal medicine for residency, and I think one of the things I'm very much looking forward to is the ability to provide comprehensive care. And so I always get really excited when I learn new things like this. Like I wasn't aware actually that there were spiritual health screening tools, and like for sure, if spiritual health is something that is like paramount to a patient's care and their health needs, I think it would be very important to like ask those three questions at the end of a visit for sure.
Mm-hmm.
For sure. So, at the beginning of the episode, we chatted about briefly about misconceptions about spiritual health.
Mm-hmm.
Like, for example, the assumption that spiritual health can only be involved if someone is religious, which now you've explained that like really spiritual health has so many roles in different patients' experiences. Are there any other misconceptions that you wanted to address today, like
Um,
regarding the specialty?
Yeah, I think that's the biggest one that you've nailed. I think that that's great. Religious care is a really important component of what it is that we do, but it's one aspect in a larger, more comprehensive lens that we bring when we're looking at caring for patients. Another sometimes is that I'll get asked, do we actually ourselves represent a particular faith or denomination?
Hmm.
And again, we don't. Our health practitioners, spiritual health practitioners, may have their own religious and spiritual background, but we do not use that in our roles. They're a part of our identity and who we are, and often why we get into the work that we do. But we're leveraging the spirituality of the patients and families themselves. We're not bringing our own agenda into that, or our own spiritual background into that. So that's another myth that's important to break down. And then another myth, I think, is often the thought that spiritual care is only for end of life care, is only for people who are dying. So again, nope. We are, in terms of, all the different other scenarios that we are involved. We're involved in much more than just end of life care, although that's a very meaningful, wonderful part of the work that we do. And again, the tag onto that too is in a lot of institutions, not all, but a lot of institutions, spiritual health and spiritual care is very much an important part of staff support and resident support. And I've done resident debriefs. I've go to critical incident debriefs when there's a really difficult death. And again, we can do some of that emotional support and care, and at times psychological first aid for staff and residents when they've gone through some really, really hard clinical experiences.
I'm sad that I'm not going to be attending Queens for my like, residency institution because if I do end up in a situation where there is a difficult death or a difficult code, for example, I think I would really want to have you debriefing me because, yeah, it's been a pleasure talking with you. And well, certainly, I'm glad that at many institutions there are spiritual health practitioners who make that a focus of their work to support people in the hospital because medicine is challenging many of the
Yes,
times.
yes, it is.
And oftentimes, like, people are very busy in medicine, and there's not a lot of space that is created to chat about things like that.
Yeah, I often, when I look at residents and I watch them and they come and they've often sometimes arrived from a whole new city and they're trying to get their bearings and they're new in the hospital and they look tired and they look overwhelmed. And I know that there's a download of information that they're trying to wrap their heads around. They're trying to understand the culture of the new workplace that they've just been in. And so it's really, really important that residents feel that there are really safe, confidential spaces where if you're having a hard day and you're not doing okay, there's somebody where you can tap on their shoulder and be like, can we take a moment? I'm not doing okay today. And we can find that space and time to attend to whatever struggles that you're going through in that moment.
That's incredible. That's really incredible. So we're coming to the end of the podcast now. Unfortunately, I really enjoyed chatting with you, Suzanne.
Me
I
too.
wanted to ask you one last question.
Mm.
I know based on what you said, given the scope of your role and like your priorities, especially when working as a spiritual health practitioner, that you have so many like lived experiences that you carry, like from like having learned from patients, having learned from like your colleagues, having learned from like being in the hospital. What is one piece of advice you'd have for like budding residents like myself, and I'll
Oh,
be starting in 2 months, about being in healthcare?
that's a great question. I think we all need to ask ourselves that question in terms of how can we take care of ourselves in that. I think that it's really important that we're realizing that we're working in a healthcare system that has been chronically underfunded for a long time. And so wherever we go, there's going to be a lack of human resources. There's going to be some systemic issues that we're kind of butting up against everywhere we go. And so it becomes paramount that we develop some really, really good self-care, emotional, spiritual, psychological hygiene, that we really, really take care of ourselves, forming, I would say, communities of care for each other. I have an amazing peer network. I have amazing colleagues that I can turn to and be really real with. I can let my guard down when I've had a hard moment and I can call upon them, and like that, they're there for me. But sometimes that actually requires you to drop your ego and to have some humility around the places that you're struggling, the places where you screwed up, the places that you did well, and whatever it is. It's really, really important to allow yourself to be human inside of it, allow yourself to make mistakes, and develop a really, really good self-care strategy. If you're gonna have longevity in the field, you can't you can't you can't not attend to your own inner needs.
Wow. If well, I do have friends who are attending Queens for residency, and I'll definitely let them know that you're around, and there to support residents, because wow, I'm thoroughly impressed by like really everything you've spoken to regarding spiritual health as a field, what you've spoken to in terms of healthcare, and like the wealth of knowledge you gave in just that short last question. It's really been a pleasure to chat with you, Suzanne.
Oh,
And
likewise.
yeah,
Yeah,
very.
it's wonderful. It's wonderful. I really appreciate the opportunity to speak with you.
Well, I barely have any words for how meaningful that episode was to me. It's really been a dream of mine to be able to speak with Suzanne about her field and her job as a spiritual health practitioner. I think she's phenomenal at her job, if it didn't come across in her words, and I think it is extremely important work, and not work that is tied to a single denomination or requires patients to be religious, as I now know, but one that allows her to be able to treat patients encountering many difficult situations. And so, for any incoming residents like myself, make sure to consult Spiritual Health if you feel like a patient would benefit from it. Thank you so much again to everyone for joining this very special episode with Suzanne Robertson. Again, if you are a resident, a part of a Royal College affiliated specialty, remember to join as a resident affiliate member, because it is free. We'll see you at the next episode. This is Cameron Wong with the Specialty Café. Thanks so much.